I'm here with Dr. Lawrence Rifkin, and Dr. Rifkin, first of all, thank you for joining us.
Terry, thank you so much. It's so nice to be here at this beautiful event. I'm really excited to be here and have this interview with you.
And you're receiving an award today.
Yes, lucky
Another
me.
award.
Oh, well, it's like, yeah, it's quite a special award. I really am excited about it, honored to have it be part of the Aesthetic Everything, because it's a group of wonderful doctors and other cosmetic specialists from around the world. To be honored and grouped in with that, it's very nice for me. I really appreciate that.
Now, you are one of the top dentists in the world, and you're not just a regular dentist. Explain to me.
I'm just a regular dentist.
You're definitely not. Explain to me what you do.
Well, you know, in my experience, which is very short of 42, 43 years, you know, I've learned a lot. I've evolved to be comprehensive in my dentistry, both from a very foundation of health, biological health, to help not only oral health, but also systemic health. That really is the basics of everything I do, because there's no cosmetics, which is the end point that the patients love, that's worth anything unless you have good health. So health function has been my evolution into aesthetics. And of course, before I was a dentist, I was an art major in college. I drew, I sculpted, I did woodworking and metalworking. I learned the appreciation of the language of art, and to appreciate all the elements, the visual elements of harmony and balance and space and all of that, weight, everything. And so what I really do is I put that all together. I put it together from the standpoint that I care about patients' health as if they were my family, and what would I do for myself? How do I want to look? Because I have my own sense of vanity. I try to take care of myself at my tender years, growing older gracefully. Still got a ton of energy, I'm just peaking. But I put it all together in a comprehensive plan so that the foundation of health and predictability is there, because, you know, patients love going to the dentist, of course, right? But less is more, okay? So if I can prevent a lot of the problems that patients experience with their teeth, their gum tissue, their health in general, I'm very happy. And then of course, the icing on the cake would be to have them have a beautiful smile, because it's not just about the physical anatomy, it's about the emotional self-esteem impact of being able to smile. Being able to smile without shame, you know, not holding back, not covering up a blemish that the patient might perceive. So working with the minimal amount of treatment to get the maximum result is really my goal, and then making it look natural and believable. I don't like patients or an observer of my work and say, oh, those are great veneers, who did your teeth? You know, to me that would be an aesthetic failure. So I like to have a very natural, believable look. So the way I do things is very minimally invasive. I work with a microscope. I use my artistic sculptural background and visual cues and skills, I hope, to create what is personalized to that particular patient, their smile, and what looks best on their face. And we go through a number of steps to achieve that.
And then you don't stop there just with the teeth, do you?
No, because again, that's a good point. I look not only at the teeth, but how the teeth interplay with the gum tissue, the lips, and the total part of the face, especially the lower face, because the balance between upper lip, lower lip, upper jawline, nasolabial folds, the nose itself, cheekbones and chin, those all play a part in the smile itself. You know, the teeth have to be balanced. Sometimes your lips are bigger than the teeth. Sometimes the teeth are bigger than the lips. How do we get that into balance? So I can't do all of the treatments myself, because I count upon my specialist colleagues, and I love working with the team, and that's my biggest push in my years right now as far as dentistry, is to really create the optimal smile, the optimal beautiful face by working as a team. I can do some limited injectables for a facial balance, but it's best put together by a team, just as if you had an architect that would have the subcontractors really have a cohesive plan. So putting that plan together really gets the balance artistically of the patient's particular face. They may be all little minor subtle treatments, but put together in the right way, in the right sequence, with a team that's communicating is the challenge. And to get that done will really optimally benefit the patient's smile. And they'll get a beautiful natural smile that's personalized to them. And that's what I really love to do beyond the teeth. I like to analyze the face.
So now you've been in the business for over 40 years.
Yes.
Is there something, is there anything new you can work on? What are you working on at the moment?
Developing a team, cohesive team, and education for all of us. I think that dentists need to become an expert in plastic surgery, cosmetic dermatology, but not be them. Cosmetic surgeons, dermatologists need to be an expert in what dental possibilities can be, but not be a dentist. You don't have to be a dentist and have this knowledge, but you have to seize opportunities. So if I was looking at someone's particular face and I say, if they're interested in improving their face maximally, their best smile, then I can suggest ideas that would bring it more into balance. And by doing so, having this type of approach and plan, we can do things digitally without anything invasive, totally reversible. We can do digital types of imagery to change the face, the smile, the lips, within the reason of what is possible, working with specialists that have integrity and have knowledge. And so that's my latest push, that's what's new. Putting together potentially software that integrates dentistry with cosmetic surgery. We want to put that together for the patient's face and their benefit, if they're truly interested in having, quote, that perfect smile being the best they can be.
Amazing, it's fascinating.
It's kind of fun.
Now, you're doing a talk today, and what will we hear you talking about?
Well, the title is Creating the Perfect Natural Hollywood Smile, because we are here in Beverly Hills at the moment, Hollywood adjacent, okay? We see a lot of beautiful smiles, some that look perfect, some that actually are perfect and natural, and some that are imperfect and not natural. And so what I'm trying to do is to develop predictability for the patient's confidence, for their self-esteem, and how to do it, how to recognize the steps that I'm trying to impart some knowledge from dentistry, facial aesthetics, facial proportions, and in art to the plastic surgeons, at least what I do relative to the dentistry, so that they have another tool in their kit, at least knowledge-wise, to suggest to their patients what could be done from a dental standpoint, coordinated with their cosmetic surgeries or dermatology.
So for people that are lucky enough to listen to you today, what are you hoping they walk out of the room having learned?
Good question. Well, my hope would be that they can look at a smile and a face with a new light, with a little bit more information that could add and embellish the wonderful treatments that they do to create the best result. Sometimes in dentistry, I'm approached lately with the new injectables of having fuller lips, which I love, but sometimes they're overfilled, and sometimes patients now don't see their teeth because their lips are too full. So now they come to the dentist.
Those are some full lips.
Oh my gosh, the lips come into the room before they do, you know, and then they don't see their teeth and they wonder why their smile doesn't look good. And so they want bigger and longer teeth, which then would be somewhat inappropriate, and sometimes it would impede their speech because the teeth have a lot to do with their speech. So now we're chasing the lips with the teeth, which is totally the wrong approach. So we have to look at what is the proper balance. You know, a little is good, a little more may be better, too much is absolutely not good. Do it with an artistic approach, because I've done lip fillers, okay? I've done Botox, and when I inject lips, or when I have injected lips, okay, to fill them, I create that Cupid's bow. It's a very sculptural look. It's not too long, fuller lips. They have to have that Cupid's bow, like multiple pillows in your lips. There's 2 on the bottom, 3 on the top, and that's what creates that beautiful curvature that we see in young, youthful, really pretty smiles.
So do you do that in your office? Can people get their lips done in your office?
I have at least the knowledge and the direction to impart to what I think is a beautiful smile, the interplay between the lips and the teeth, to other surgeons or nurses that are going to do this, that do it with a little bit more knowledge of what should be the length of the upper lip, what should be the length of the lower third of the face, how large should those lips be, and how should they be shaped, based actually, Terry, on an embryological how the lips form. Embryologically, tissues form as a little baby, a fetus, where tissues come together and they grow together, and these little balloons of skin join together, and where they join, sometimes there's a little curvature, there's a little notch. That creates the Cupid's bow in the lips. But that's my passion, is lips and teeth.
My daughter has the perfect Cupid's bow.
Oh, don't they have? Oh, they're so filled with fat, they're so chunky, that's great. Yep.
That was perfect. Is there anything you think we missed that you'd like to touch on?
So in dentistry, this is my push also, to get other doctors to start using this magnification tool. It's just a tool, but it's a tool that can increase your knowledge, increase your diagnostic ability, can increase your execution in a minimally invasive way. So when I look at gum tissue around veneers or crowns or fillings, they have to be pristine and healthy, because bacteria can accumulate at an imperfect edge. So the edge has to be so precise it eliminates bacteria, and those bacteria actually go throughout your body. They go through the gum tissue, and they systemically can cause multiple diseases. Medical science is really showing that a lot of diseases are related to the entry of bacteria, which is obvious through our mouth, our nose, our lungs, and other body parts and cuts and things like that. They go through the skin. So the gum tissue is very, very fragile. And when you brush your teeth and bacteria is in there, if you don't eliminate the bacteria, a huge bulk of bacteria go into your circulatory system, and they've even shown in atherosclerotic plaque in arteries, the same bacteria that's in your mouth is in those plaque. And that plaque can actually burst. It's called an eruption, and it creates an embolus, which actually creates a blood clot. And those blood clots can cause a heart attack, a stroke, a pulmonary embolism, and many other diseases that are related to the bacteria. It's a huge flora of bacteria. So I really want to emphasize is that the foundation of health must be there, and the microscope is a tool. So I was president of Academy 2 years ago, and I'm putting on a program in a couple of months here in Hollywood on how the use of the microscope can enhance the quality of care for dentists and dental specialists and keep the patients well ahead in prevention to diagnose and treat problems earlier. So that's huge. And plus the comfort is also important, because if patients are not comfortable in the office, they don't come in.
They don't want to come in.
Yeah,
exactly.
so if you want privacy, I also have a private suite, and that's called my Suite 1200. And so I call it my VIP luxury suite, but everybody's a VIP. Everybody can come in there. Depends on your anxiety level. I want them to just be totally at home. So if you have a family member with you, they can sit in a lounge area, be very comfortable. They can have food service, concierge service, and just get a lot of treatment done in the most comfortable atmosphere with an anesthesiologist if they request, just so that this experience is wonderful. I always say the journey is just as important as the destination. So I want them to have a really great time there.
You are a perfectionist.
Well, you know, it's a double-edged sword, right? It's like it's a quality and it's also a curse, the same thing.
Fascinating. I'm so happy to speak to you. Thank you
My
so
pleasure.
much, and congratulations again.
Thank you so much. I really appreciate it. Lovely to speak with you, and thank you for asking such good, insightful questions.
Thank you.
You can reach me on my website, which is drlawrencerifkin.com, drlaurenCE.com. My Facebook ID is Dr. Lawrence Rifkin DDS on Facebook.